This is The Law Show on CL 650. Now back to the show.
Our guests are from MurphyBattista, LLP, Vancouver personal injury law firm downtown at 650 West Georgia in the Scotia Tower. In studio with me, Joe Murphy and Derek Maw, personal injury lawyers. We talked about, before the break, we talked about what's an appropriate time to see a lawyer, what's an appropriate time to sort of learn to navigate your way through the maze created by ICBC and any other insurance, because a lot of motorists carry ICBC plus private carrier second level insurance. So we talked about what's a good time to sit down and find out where you stand legally. And the answer to that is the sooner the better. If you're confused or disoriented or just you've been in an accident and just this is something that's never happened to me before and all of a sudden it got really weird really fast, call MurphyBattista. Call Joe. He says in many a 10-minute phone call has been able to relax a very agitated person who's just been in a traffic accident only to discover it's pretty normal, it's pretty routine, and if you follow these few steps, you should be okay.
Sterling, on that point, one thing that we should add is in some cases people are too practically hurt to come in to see us.
Good point.
And we will go see you, and that makes the process much easier for you because it's just that how do you come to see us when you're bedridden or you've got a broken leg or whatever the case may be?
Okay, so that's a good thing to know that you don't have to arrive at the office on a gurney necessarily. If it's just impossible for you to get there, well, MurphyBattista will come to you. Now, we talked, Joe, a little bit about the quarterback. You've both used this expression, quarterbacking an individual's rehabilitation process. You have suggested, Joe, that in past practice at MurphyBattista, you've hired, from time to time, occupational therapists to quarterback an individual's rehabilitation process. But, Derek, you've also said that in a lot of cases, the family doctor is called upon to be the quarterback because in many cases that's the first person the injured party goes to see. I got banged up in a car accident, Doc. I just don't feel right. And, well, as I pointed out just before the break, Derek, doctors aren't lawyers, and many of them are frankly reluctant to get involved in a lot of legal stuff. Isn't that the case?
Yeah, that's correct, because I think what happens with the family doctors is their patient comes in, and I've been in a car accident, they start to think, now I have to fill out all these forms. I know there's going to be requests for forms from ICBC.
Right.
If you have a lawyer, your lawyer's going to ask me to write a report for you.
Right.
This is a lot of paperwork that I don't have time to do, and they don't want to do it, and that's the unfortunate part of it. And they're thrust into this role of being the quarterback for your rehab, and there's nothing, I don't want to talk ill about family doctors, they're simply just not trained to be in that role. They go through medical school and they learn about, family medicine.
Sure.
What do people come in for? Who do I need to send them to? But now they're being asked to be the quarterback for that care. And so it's not practical, I think, to have an OT or an occupational therapist on every single claim. It's just not going to happen.
Right.
But on the more significant claims where that's necessary, that's when we will hire an occupational therapist to help direct that.
And I think, Joe, it's to just follow up on what Derek was saying. There's no point in trying to badmouth family doctors. They are among the busiest human beings in our province. Their practice, they are swamped.
Yeah.
So to ask them to do legal tap dancing on behalf of a patient that they're genuinely concerned about is really asking quite a lot of extra from people who are already really super busy, isn't it?
Without a doubt. The other restriction a family doctor has is they may be unaware of various therapies or treatment that's available in the community.
Right.
Because unless it's part of the MSP system, it's not something they commonly deal with. So they will be aware of physio and massage and maybe chiropractic, but when it comes to speech and language pathologist, a variety of other things, exercise therapist, kinesiologist, those are outside the normal system, so the doctor's not going to be aware of that.
Right.
And the doctor, as Derek said, they just don't have time. So they don't have sometimes the knowledge, they don't have the time, and oftentimes people don't have a family doctor. So those are all good reasons why we turn to the occupational therapist, whose job is to do this kind of work. This is exactly what OTs do in their practice. They manage treatment and rehab. And they do an excellent job at it.
And a well-intentioned family doctor, Derek, with the pile of paperwork that he or she can be presented with following an accident to claim and so on, they want to act in the best interest of their patient. After all, you're my doctor, and I'm,
Yes.
all of that. So that relationship is there. But sometimes when filling out all of these forms, there are terms that the doctors simply aren't familiar with, and there's ambiguity in the questions. And rather than err on the side of somebody being able to point a finger at their client for not doing something right, they'll leave something blank that needs to be filled in. And again, they're just in over their heads in terms of the assignment they're suddenly now a part of.
I think that's a fair comment, and I think what ends up happening is family doctors are happy, I believe, when they see that they have a good lawyer. The patient's got a good lawyer on their side, because the lawyer will help them direct what they need to do, whether it's an OT or kinesiologist or what have you. And we'll work with the family doctor to do that. I've had clients before where the family doctors called me and said, I really need an MRI done of this person's knee because this is what I suspect is going on.
Right.
But if I put them on the wait list for the public system, it's a 6-month, 8-month wait.
Sure.
Can you get them in faster? Yes, we can. You just need to sign a referral form for us. And then we'll send that off. They sign it off. We get that done within a week. And then at that point, that patient's treatment can be progressed. If that person needs surgery, they can be put on a wait list sooner than waiting that 6 to 8 months to get that public MRI done.
Right. Just back to your days, before you became a lawyer, you spent 5 successful years as a physiotherapist. During that time, Derek, were the majority of your clients people who referred to you as a result of needing therapy because of accident or injury?
I worked in 2 places. I worked in a hospital and in private practice. So the hospital was more from elective surgeries, knee replacements, hip replacements.
Okay, right.
But in private practice, yes, absolutely. A lot of people through the car accident systems.
Okay. So, Joe, the difference between years ago when the family doctor had a little bit more time and was able to be a little more of an activist on the part of his or her patient, times have changed. And as you pointed out just a few minutes ago, it's more likely than not that a person in British Columbia is going to not have a family doctor. They'll show up at your office with a story of an accident.
And pictures, usually.
And pictures, phone pictures, dozens if not hundreds of phone pictures. But a family doctor? No, I'm sorry, I don't have that. We don't have one. So then what?
Well, those people, Sterling, in reality go to walk-in clinics. And doctors in walk-in clinics have even less time to devote to the patients they see.
Yeah.
Walk-in clinics, I go to a walk-in clinic the odd time. If I've got a 5-minute medical matter to deal with, walk-in clinics are perfect.
Sure.
And I use it. But if you want continuity and you've got a complicated medical picture, walk-in clinics just don't fit. They don't work. But for some people, they're the only choice. And if anything, that underlines the reality that you got to find someone other than the family doctor who's going to quarterback this rehab program.
It sounds kind of scary, though, if you don't mind my saying, Joe. If you're going to organize a rehab program for an injured individual, quarterbacked by an occupational therapist who really does this for a living, who's really got it down. But all of a sudden, if I'm that injured person or his or her family, I'm going, oh, my goodness, look at all these people they're bringing in. And, you can just see the bills just piling up. And, there hasn't been a claim filed, or maybe there's a claim in the works, but somebody's so badly hurt, they're no good to anyone right now until they get better. So... But, what about family members when you start recommending these approaches and they go, we can't afford that? And Mr. Murphy, I'm sorry, we can't let that happen. Then what do you do?
Well, Sterling, what we do is we explain to the people that this therapy is going to facilitate an early and a good result. So there's a real benefit to the person to have it, and we will deal with ICBC and, if necessary, make other arrangements so that the therapy is not withheld simply because the family doesn't have the cash to pay for it.
So ICBC, even before the claim is resolved, it's going back to this no-fault benefit stuff.
Well,
so there's some cash will flow because of the fact that you were injured in an accident.
Some will, but not enough to pay for everything.
Okay.
So that's the job we have, is to try and bridge the gap between what's needed in the ICBC funding. You can't let the ICBC funding dictate what the treatment is going to be. That just doesn't make sense. It's not a good idea.
And what happens, though, Joe, and we've spoken about this in the past, but, you know, a lot of people hearing this for the first time, what happens in a personal injury lawsuit that takes years to get resolved? And then there's a decision, we're going to appeal that, and we're going to appeal that. So on and on and on. All these expensive bills keep piling up, and there's no resolution. So what happens then?
Well, the reality is the law firm pays those bills until the end of the case.
Oh, okay.
That's the reality. But cases take a long time usually because the injury takes a long time to work out. I call the expression I use is, you have to wait till the dust settles before you try and finish a case by either settling or going to court.
Right.
With a child, and I've had kids cases that I've spent 18 years from start to finish on because this was a little young child with a brain injury, and we waited 18 years to see what at age 19 or 20 that brain injury was going to do to her life. And we have to wait that long because until then you just don't know.
But in the ensuing years between the tender age of 1 or 2 and the age of majority of 19, that child has probably run up quite the tab of bills and all the provisions of life that mom and dad simply couldn't afford because of the nature of the injury.
Yeah, the ICBC Part 7 benefits provide some funding. In some cases, ICBC will make advances, additional money, understanding that further treatment is necessary.
Okay.
If liability is not an issue, and with a young child, liability is rarely an issue. They're not driving.
Right.
But you can get that. But other than that, I think the job of the law firm is to make sure they get the treatment they need because that ensures the best possible result.
Okay. We'll take a little quick break here, and then we'll come back and we'll talk more about treatment and rehabilitation and those ICBC Part 7 benefits with our guests Joe Murphy and Derek Ma from MurphyBattista in Vancouver. And we're back right after this.
There's more of the show still ahead. This is The Law Show on CL 650.